I heard from a dentist late last week. She's looking for clarity from the Department of Health. She's heard from the Rhode Island Dental Association, which has offered some suggestions on phases, but they don't quite coincide with the Department of Health. So where is it with dentists' office right now?
We have been working very closely with our oral health community, recognizing the specific and unique elements that occur with that community. So we've supported them in being able to open in phases the way they need to. We've also worked with being able to provide the types of PPE that we have available that we can provide. So we'll continue to align the guidance that we have with what works best for our oral health and dental community going forward.
So her situation is PPE, and she said through the Dental Association, she got 10 large masks, 5 small ones, and 95s, and said that's a month's supply. At the beginning of the crisis, she donated $6,000 worth of masks, surgical gloves, hospital-grade disinfectant. Now she wants them back. So with all of these resources that we have, her issue is PPE. She's an older dentist. She's been at it for 35 years. And quite frankly, she said if she can't open up by July 1st, she's going to close permanently. And there are other doctors, because they're on the front line, older and in that demo. So she wants to know where the state is in terms of these specific needs, PPE.
Yeah, PPE has been the #1 need that we have been in discussions with our oral health community. Anything that we have access to that we can provide equitably across the board, we have been doing, particularly the surgical masks. It has been challenging from an accessing standpoint statewide to get some of the other elements. Gowns, as the governor has shared in the past, have been short. Being able to have N95s and face shields. It's something that we need to continue to work with the oral health community, helping them also in finding where we can get additional access to supplies. As we get it, once we have enough, we're sharing, but we recognize the challenge with the additional components of PPE.
Couldn't the state have seen this 2 months ago? Does the state not have enough now, or is there not enough being manufactured? Why is it not available?
We have had this as a priority since the beginning. There's a large group of providers within the healthcare industry that we're needing to respond to with some of those more medically advanced PPE components. So we have provided them to the oral surgeons and worked with practices that have been able to keep certain procedures for dentists available where patients need oral health, but the entire dental community makes it more challenging to be able to get enough of some of those more advanced medical supplies. But anything we have, we're getting to them across the board.
Thank you.
Governor, were you on this call with President Trump today where he's reported to have exhorted governors to get tougher with demonstrators?
I was. Yes, I was on the call. In fact, yes, it was our weekly call.
What was your reaction to that, and what is your response to that?
You accurately summarized his comments. He urged us to be tough, and the word he continued to use over and over again was domination. He said the only way to deal with certain protesters is to dominate. So my reaction to that is, number one, I think we need to do, all of us need to do whatever we can to ratchet down the violence and to ratchet up our listening with empathy and sincerity. And so that's going to be my approach. Having said that, look, we're going to do what we need to do to keep Rhode Islanders safe. Thank God we haven't seen some of what you're seeing in other places around the country, looting, extreme violence, fires. We'll do what we need to do. I want Rhode Islanders to feel safe. We will protect our community. But I think overall, we need to all be asking ourselves, what can we do to play a more peaceful role? And I find rhetoric, which is overly aggressive is actually not that productive and incites more anger and violence.
Governor, you've sort of touched on this, but just to go back to it, do you believe that the COVID-19 crisis and the inequities that we've been able to see firsthand throughout this process are amongst the root causes of what we see with these demonstrations around the country? And is there a way to tie it all together, especially for folks right now who are, maybe their perception is that these events, the looting and so on and so forth, is coming from more of just a purely violent place and not from an expressive standpoint?
So look, this is complicated, and you unpack a lot in what you say. So I'll try to answer it this way. Racism existed before COVID. It is ugly in all of its forms, and we all need to do more to stamp it out. Economic inequality, housing inequality, healthcare access inequality, education access inequality existed on the basis of race before COVID, and we all have to do more to bring about a more equal society. Having said all of that, COVID has just exacerbated it in many ways. I mean, look, Dr. Nicole Alexander Scott just got up here and said, where are we seeing 25% positive rates? It's in Central Falls. It's in the communities of color, poor communities, have been disproportionately affected by this. People who don't have access to health insurance. Thankfully, in Rhode Island, that's not that many people. But so anyway, I think it's just added fuel to the fire. I think the anger existed before, and it's legitimate. I think it's getting worse now. And then when you overlay on top of that, people are out of work, stuck in their houses, that just adds a whole other layer, which is why my comment to Steve is we have to try to maintain peace and move to a more just place. But also you have to recognize there's a lot of angry people, and it's hard to blame them.
Governor.
Was off topic. So Governor, are you open to having a guest speaker at some of these briefings, maybe 5 minutes or less? Somebody maybe from a hospital setting, someone from the education world, a principal, a teacher, a superintendent, someone from a local bank, vice president, for example, who wants to explain about a new initiative for something that'll be beneficial to Rhode Islanders financially. As long as if it's positive and can be very beneficial or helpful to Rhode Islanders, would you be open to 5 minutes or less for somebody to be at the briefings?
Yeah, I think it's a good idea. We, now that we're entering into phase 2, we're generally thinking about the format of communication. So yes, absolutely.
When people see the protest over the weekend here, and a large crowd, but you said wearing masks and socially distancing, does it change your thinking at all, or what do you say to people who are going to see that and say, okay, how come we can't have some other larger gatherings, especially later on in the summer, if we're wearing masks and socially distant, and one's okay and one's not?
Yeah. So let me say this: all large group gatherings are a problem as it relates to virus containment. That's a scientific fact. And the more large group gatherings that we have, where people are close together, particularly if they're indoors, we run the risk of that's creating more problems with the virus. And so that's why I said, as I've said to all the protesters over the past couple of months, yes, you have a right to protest, but I'm asking you to do it following the socially distanced rules, because if you don't, you're putting the health and safety of all the people of Rhode Island at risk. My approach the whole time, whether it's been beaches, graduations, protests, whatever, we put out the guidelines. We are here to tell you what we think are the best practices for keeping Rhode Islanders healthy and safe. And then I'm asking the people of Rhode Island to follow the rules. And that's the way it works for everybody.
I just felt, has there been any thought, I know Massachusetts has said later on in July, maybe in-person graduations could be held. Has there been any thought to kind of updating the guidance in Rhode Island? We have some questions about that.
Well, here's what I would say. The way we've done it is we've put out guidelines, phase 1 and phase 2, and asked superintendents to work with their communities, to get creative, and properly acknowledge the students who are graduating. So in phase 3, in July, hopefully, the social gathering limits will go up. There will be a greater relaxation. So if at that time a superintendent, decides they want to do something more within those guidelines, then they can do that. But I'm not going to tell them what to do. It's the same thing. We're going to tell them, these are the rules to follow if you want to keep your community safe. And then within that, the superintendents, principals, community kind of need to figure out how to do that.
Governor, I got an email over the weekend from a woman named Nancy in Warwick who lives in an assisted living center, not a nursing home, but assisted living. She said, I have been in my apartment since March 11th. And her argument, to summarize it, I guess, was that she feels that nursing homes and assisted living can be quite different. She said some of us have cars, we are still fairly independent, and yet we're kind of getting treated like these very frail patients. And is there any thought to, I guess, distinguishing at some point between the assisted living setting and the nursing home setting?
Yeah, we have been talking about this, and I'm going to let the doctor handle it.
We've recognized and understood the challenge, have felt the challenge of people not having the access to visitors or being able to get around to the extent that they would like to. What we want to do, particularly during this phase, is really be able to work more in a more tailored way with facilities going forward to put together a plan, because individual facilities, nursing homes versus assisted living, will have different levels of capacity, different numbers of people to respond. So through phase 2, we want to keep it the way it is in terms of no visitation, but want to actively work towards what type of approach would work best. Similar to how the governor expressed it, our focus is recognizing the gradations of risk that occur. The older someone is, the more likelihood that they have underlying illnesses, the more they are in a congregate setting, the higher the risk. As you walk back from that, you can still have the risk in people who are more independent and older. My own mother, in her early 80s, has also been in her home for several weeks, and we're figuring out creative ways to work through it. But as a retired director of nursing, she understands the importance of this approach in keeping her safe. And we'll work with Rhode Islanders to get to a point that we can continue to keep as many people healthy as possible and maintain their safety with that as well.
John? Governor, can I just, this morning, you referred to yourself as a white woman of privilege. Now, you grew up in Smithfield, and you mentioned how your dad lost his job. You applied yourself, you thrived at LaSalle, got into Harvard, Rhodes Scholar, Yale. Don't you think by saying that, that minimizes the clear efforts that you put in, that your parents put into you to have you thrive,
Yeah. I don't. Look, you're right. My parents sacrificed enormously for my brother and my sister and I to have these opportunities, and I worked my tail off my whole life. But I don't know what it's like, because of the color of my skin, to be afraid to walk into a convenience store at night. I don't know what that's like. I don't know what it's like to be just discriminated against and viewed differently just because of the color of my skin. And so while I can say racism exists, and I see it, and I work hard every day to do everything I can to deal with it and make Rhode Island a more fair place, I don't know what that's like. And I think that I just need to be honest about that. I think of myself as not a person who's not prejudiced. I'm not. But I think we all need to get a little more honest and check our privilege and prejudice just to have an honest dialogue. So it doesn't take anything away from how hard I worked. Yeah, you're right, I wasn't born wealthy. I didn't have a lot of those advantages that a lot of other people did. But I've never been the victim of racism.
Can you also just touch on how people listening right now, the outbreaks in Providence, Central Falls, isn't that perhaps more just an element of a lot of people living congregated as opposed to, are we now to believe that the outbreaks of racism involved?
No. So let me, thank you for saying that. You're exactly right. The reason the outbreaks are in these areas are multifaceted. You have immigrant populations who are afraid to come get tested, and that, I get that. I'd be afraid too, maybe. You have people who are poor and they feel they can't afford to get tested. You have people who fear losing their job if they get a day out of work, if they have to take a day out of work. So that's related to poverty. And then you have exactly what you said, it's the density. The density is just horrible with this virus. That's why you look at places like Wyoming and Montana, it's so much easier to control the virus if you're a big rural place. So absolutely, if you have, 8 people of multi-generations crammed into a small apartment with one bathroom, it's really hard to isolate and do infection control. So those are the reasons. All I'm saying is the facts are, if you look at who's being hardest hit, folks of color are being hardest hit.
So, given that today's the first day of the second phase, you figure it's going to be about 2 weeks before you know how well or poorly things are going to be going?
No, I think it'll be, closer to a month. I think it'll be closer to a month. I have said around July. My friend Brian always says, will it be July 1st? I say ish. We want 14 days to make some changes and about 14 days to observe them. So end of June, early July. Assuming things still look the way they do. This is a big phase.
Are you worried at all about the potential for outbreaks related to the gathering?
Yes.
On Friday? And there might be another one. I mean, is there any strategy in place, or is it just watch and see if those people start getting tested positive?
I'm worried about it. I'd be crazy not to be worried about it. Basically, I was just talking to John. I mean, we know this virus thrives when people get together in big groups. Thankfully, outdoors is much safer. So we are trying to come up with strategies, right? We're trying to come up, a strategy of having a heavy-handed enforcement approach to peaceful protests, I don't think is a good strategy, but maybe we offer testing. Short answer is we're working on it. Testing, contact tracing, public health response to allow protest, but to do everything we can to make sure there's not an outbreak.